Do these drugs work? Are there side effects? And who can get them? We actually have the perfect guest for you. Dr. Decotiis specializes in medical weight loss. She has a private practice in New York City. And doctor, some of the brand names, we all know them: Ozempic, Wegovy, Mounjaro. Assume for a moment there is no such thing as a side effect. Do these drugs work?
Absolutely, and the studies that came out blew everybody away, especially when Mounjaro came out, because Ozempic was already such a hit. And then when they did the Lilly study, they found that patients lost 5 to 7% more weight than patients that were on Ozempic. So that was like thrilling for everybody. And if these drugs are used properly and perhaps for a certain length of time, they really can re-regulate someone's metabolism. So they can get off these drugs, and they're going to find that they're burning more fat, burning more calories, exercise gets easier, and they start craving healthy foods. So it's almost too good to be true. It's actually true if these drugs are used properly. And I see that in my practice every single day.
So now let's talk about the side effects. And I want to play for you what a doctor told Scripps News. Take a listen.
I would say it's a risk versus benefit situation. I think pharmacology is a tricky business. I think if you open up any label on any drug, you could pick Tylenol, aspirin, things that we've taken for years. Well, if you open up to the side effect pamphlet, there's a litany of items listed there.
So Dr. Decotiis, the makers of these drugs, saying there could be some gastrointestinal or GI issues. What should people know?
Well, the most common side effect are these GI symptoms, such as nausea, vomiting, and some reflux, where you feel like you're tasting your food again. A little constipation as well. However, most of these side effects can be mitigated with drinking enough water, and many doctors are not telling their patients that they might need to drink upwards of a gallon a day. Now, there are more serious side effects where the stomach goes into a real spasm and doesn't process food. That's highly unusual. And then there's also pancreatitis, which is also highly unusual. I've never seen a case. And I've been using these medications now for quite a while in my New York City weight loss practice.
Doctor, realistically, how much should someone expect to lose if they start on these drugs?
You can lose up to 20 or 25% of your body weight, which is pretty amazing. And I know I keep beating this to death about using these drugs properly, but when someone is hydrated and monitored, they do not cause muscle to be burned. So you're able to preserve or actually increase your muscle mass. So you hear all these people concerned about Ozempic face and they've lost muscle. I don't really believe that occurs if a patient is using the drug properly, because these drugs not only curtail appetite, they enhance the way insulin functions. And insulin is your major fat burning hormone. If your insulin is not working well, then you're not going to be able to burn fat. You're also not going to be able to lose weight at the gym after a certain age either. So once we turn insulin on, it's like flipping a switch and the body starts burning fat. That's the mechanism of action.
Once you start taking a medication like this, how hard is it to stop?
It can, well, the thing is, it doesn't get you high. So you're not really getting any real highs from this. It's not an addictive drug, but I think you want to get off it once your body fat is down substantially. You don't want to stop it before your body fat is down. So let's say, Del, you wanted to lose 30 pounds. You were on these drugs, you lost the 30 pounds, and then the doctor said, okay, Del, we don't need to give this to you anymore. But you're going to gain the weight back, because we really have to be sure that, number one, that you actually burn body fat. Okay, that's number one. Number two, we want to kind of support insulin while it adjusts to its new body set. So after you lose a lot of weight, your body metabolism resets, and it may reset at a lower rate than it was before initially.
Dr. Decotiis, we have a lot more to discuss, like supply shortages and whether the government should be paying for them. We'll be joined by a reporter who specializes in her coverage of these issues as we continue this episode of Scripps News Reports, Weighing the Cost.